Hello everyone, welcome back to my channel. In this video, let us see some important MCQs of vitamins. So, any competitive exam, if you have seen previous question papers, definitely vitamins, at least one or two questions will be asked. So, we need to be thorough with vitamins and its deficiencies, and sometimes sources can be asked. Vitamins are of two types, that is fat soluble and water soluble vitamins. Fat soluble vitamins are A, D, E, K, whereas water soluble vitamins are B and C. Again, under B, we have B1, B2, B3, B5, B6, B7, B9 and B12. So coming to fat soluble vitamin A. So vitamin A is also called as retinol, and it is importance in maintenance of normal vision, and it helps for the promotion of normal skeletal and tooth development. It is used for promotion of normal cellular proliferation. So vitamin A deficiency causes night or total blindness, epithelial changes, as well as xerophthalmia, that is dryness of eyes, then inadequate tooth and bone development. So xerophthalmia is caused by the deficiency of, so sometimes this question is repeated, it is caused with the deficiency of vitamin A. Coming to vitamin D, liver and kidney play a role in vitamin D metabolism, and vitamin D is important for intestinal absorption of calcium, mobilization of calcium and phosphorus from bone, and renal absorption of calcium. So we need to know the importance, then only we'll come to know the deficiency. So vitamin D deficiency causes rickets in children, osteomalacia in adults. So this question most of the times it is repeated, and sometimes the question can be asked, tetany is caused by the deficiency of. So vitamin D deficiency causes even tetany as well as poor dental health. Coming to vitamin E, it is an antioxidant and it maintains the integrity of cellular membranes, and it is protection of vitamin A from oxidation. So vitamin E deficiency leads to increased hemolysis of RBC, that is destruction of RBC. Then vitamin E deficiency can also lead to poor reflexes, impaired neuromuscular functioning as well as anemia. Coming to vitamin K, so it is important for blood coagulation. So if there is deficiency of vitamin K, then there is prolonged clotting time, and it can cause hemorrhagic disease of the newborn, that means bleeding disorder, mostly in the premature babies we can see. So these all are about fat soluble vitamins, that is A, D, E and K. Coming to water soluble vitamins, first one is vitamin B1. It is also called as thiamine. So thiamine, another name is B1, like that questions can be asked in different ways. So vitamin B1 deficiency causes beriberi, that Wernicke's encephalopathy, that is impaired sensory perception, then Korsakoff syndrome, it is due to alcoholism, and it will cause damage to the nerve cells of the brain and the spinal cord, and it is caused mainly due to chronic thiamine deficiency, and irreversible dementia also caused by vitamin B1. So whatever I have kept in red, these questions are repeated most of the times in the previous exams. Coming to vitamin B2, it is also called as riboflavin. Vitamin B2 deficiency causes araboflavinosis, then chelosis, that is cracks in the lips, glossitis, that is inflammation of the tongue, seborrheic dermatitis or pseudosyphilis, particularly affecting scrotum or labia majora, then pharyngitis, sore throat. So chelosis is repeated question. Vitamin B3, it is also called as niacin. So vitamin B3, niacin causes dash. So pellagra, that pellagra is also caused due to deficiency of tryptophan, that is a precursor of nicotinic acid. So pellagra leads to 4 Ds, that is dermatitis, diarrhea, dementia and death. Vitamin B5, it is also called as pantothenic acid, and its deficiency leads to acne and paresthesia. Vitamin B6, another name is pyridoxine, and vitamin B6 deficiency leads to peripheral neuritis and sideroblastic anemia. Coming to vitamin B7, it is also called as biotin. So biotin deficiency leads to impaired growth and neurological disorders, mainly in the infants. It does not cause any problems in the adults. Coming to vitamin B9, it is also called as folic acid. So vitamin B9 deficiency causes macrocytic anemia, and elevated of homocysteine can be seen, as well as when the folic acid is deficient in the pregnant women, it can lead to neural tube defects in the babies. Vitamin B12, it is also called as cyanocobalamin. So vitamin B12 deficiency leads to macrocytic anemia, peripheral neuropathy, memory loss, cognitive deficits, as well as pernicious anemia. So it is a repeated one. So cyanocobalamin deficiency leads to pernicious anemia. And coming to last one, vitamin C. It is important for protecting against the infection, wound healing, iron absorption, and it is an antioxidant that protects vitamin A and E from excessive oxidation. So vitamin C deficiency can lead to inadequate wound healing, increased susceptibility to infection, and scurvy. So most of the time vitamin C deficiency leads to dash, that is scurvy. So please like, share and subscribe my channel for the upcoming videos.